about toxicity and health effects of asbestos, and I'm going to present asbestos-induced mesothelioma, and Wahid is going to present asbestosis, and Nessa is going to present lung cancers. So I don't want to repeat the information that yesterday was presented about asbestos, but just few things that are important for mesothelioma. So asbestos is a well-known carcinogen, and it is the primary cause of mesothelioma. Two main types of asbestos are known, chrysotile and amphibole. Both of them are causing mesothelioma. However, amphibole is more potent in causing mesothelioma. There are two main types of exposure, commercial and industrial exposure for workers, and second-hand exposure for family members of exposed workers. These exposed workers who are, these people who are working in asbestos mines, they can carry on the asbestos fibers with their clothes and shoes to their home and be a source of exposure for their family members. This table shows the dose response data for carcinogenicity of asbestos by inhalation exposure, and the information was taken from the EPA site, and it shows how occupational groups would be exposed, and for example, for insulation workers, if they are exposed by mixed fiber types, 375 fiber per milliliter per year, they are increasing the risk to develop the cancer about 1.5 time. And now about a little information about mesothelioma. Mesothelioma is a rare form of the cancer, and it affects the body's internal organs and structures, thin cell wall lining called mesothelium. And the latency period between the exposure, once people get exposed to mesothelioma, and the period between exposure and developing the symptoms is 30 years and longer. And the median survival period after diagnosis is 9 to 12 months. The global burden about mesothelioma is that about 43,000 people and more deaths and more are annually die from the disease, and about 564,000 disability-adjusted life years are known from the malignant mesothelioma. This information is from the 2005 WHO's report. And there are two main types of mesothelioma, pleural, peritoneal, and pericardial. And pleural mesothelioma is a rare cancer and the most common form of the mesothelioma. It affects a thin membrane of lubricating cells that lines the lungs and chest wall, called pleura. And in this picture, you can see the changes that caused by asbestos fibers via inhalation. People can get the fibers are lodged into pleura, and they change they have a plaque. They made a plaque in the pleura, and the tumors in the lining of patient's lung was first found in 1819, and but the doctors has no clue what is the cause for the tumor, since until the 1916, when the scientist named Wagner clearly attributed this cancer to asbestos exposure. Wagner's team identified 33 asbestos exposed pleural mesothelioma, and 32 of them, of that patients, were asbestos exposed. There is little information about other causes for pleural mesothelioma. The main place is given to asbestos exposure. However, in some studies, there is written that some particles which have the same structure as asbestos could also be caused to develop the pleural mesothelioma. And it is diagnosed in people who are exposed to high levels of asbestos by inhalation. And it is the only type of mesothelioma that's classified by stages, so it has 4 stages. And 10 years and more are needed to detect these changes in the pleura. There are some early symptoms for pleural mesothelioma which are very often misunderstood and misdiagnosed. However, roughly 60% of patients have lower back or slight chest pain, shortness of breath, difficulty swallowing, persistent cough, fever, weight loss or fatigue, and some additional symptoms like muscle weakness, loss of sensory capability, hemoptysis or coughing cough, blood, facial and arm swelling, hoarseness. There is no cure for pleural mesothelioma. However, surgery, chemotherapy, and radiation are done to treat the disease. Surgery is done mainly by pleuronectomy, which includes the removal of the damaged part of the lung or the whole lung, and extrapleural pneumectomy, which is more comprehensive procedure and includes the removal of whole lung, of the pleura, of diaphragm, and also of the pericardium. Chemotherapy is the most common in the treatment of pleural mesothelioma, and two anti-cancer drugs are approved by Food and Drug Administration. So aluminum and cisplatin combination are used for that purpose, and radiation also are done to treat the disease. However, it alone would not be useful for the treatment process, and very often it is used with surgery and chemotherapy. And there are also some alternative and complementary therapies such as acupuncture, massage, and reflexology, which are mainly done to increase the effectiveness of the main treatment. And the second type of the mesothelioma is the peritoneal mesothelioma. It has a quite rare incidence. About 20% of mesothelioma cases are peritoneal, and it is clearly identified that the only cause to develop the peritoneal mesothelioma is the exposure to asbestos, whether by ingestion or by inhalation. It occurs in the cell wall surrounding the abdominal cavity, and about 20 to 50 years are needed to detect these plaques or calcifications in the abdomen. So there is also no treatment for the mesothelioma, for the peritoneal mesothelioma, and the most common type of, no cure for the mesothelioma, but the most common type of treatment is chemotherapy with the same anti-cancer drugs, and also surgery is done when the patients are fortunate to diagnose in early stage of the disease. And the rarest type of the mesothelioma is the pericardial mesothelioma. About 10% of mesothelioma cases are pericardial, and the only cause to develop the disease is the exposure to asbestos. As for other types of mesothelioma, the prognosis also are poor for the disease, and also there is no information known how the asbestos fibers can reach the pericardium. However, by some doctors' estimation, the fibers could be just in bloodstream and lodge in the pericardium, or very often pleural mesothelioma can metastasize, and also it could be caused to develop the pericardial mesothelioma. And chemotherapy and radiation are most common in treatment. Surgery is not done because of the location of the tumor. And we can see the plaques in the pericardium. As I've already mentioned, the diagnosis for mesothelioma are poor, and often they are misdiagnosed. However, there are some steps that physicians are going to identify the disease. The first stage that they do, they first of all looking at the full medical history of the patient, where the asbestos exposure occurred, the length of exposure, and the amount of asbestos that were exposed. And then some imaging scans and biopsies are done mainly to see the location of the tumor, or to see whether it is metastasized or not, and also biopsies are done to identify these malignant cells. So this is more references. Thank you.
Questions?
Thank you. Could you please go to the exposure slide? The second or the third one. So, do you think are there any other exposure types that could be attributed to the asbestos exposure?
You mean like by air, by water, or by the pathways?
Yeah, the pathways and the exposure types itself. So you mentioned the commercial, so occupational exposure, and secondary exposure. So can you elaborate on secondary exposures? What are the other risk groups that could get exposure to asbestos?
The risk groups, mainly I found from the literature that the family members of that exposed workers are the group of people that could be second-hand exposed by asbestos. But the other information that how AS people can get exposed, I didn't find any other information about asbestos exposure and development of mesothelioma.
So only people who are working in these asbestos factories and only their family members can be exposed to asbestos.
What about asbestos at homes? Can homeowners be exposed?
There is, I didn't find any exact information which says that the homeowners who are not demolishing anything or who just have asbestos at home, I think it could be, but I don't find any evidence that I can prove this it is the source of exposure.
So you mentioned inhalation and you mentioned ingestion. Can you elaborate? So can ingested asbestos lead to cancer?
From the EPA site, it is stated that in the EPA site it is stated that some studies are done which prove that the water could be a source for ingestion to develop the cancer, the diseases which are asbestos exposed. However, there is no not clearly identified doses. There is no clear evidence for that, and they say that maybe these studies are underestimated. Because of that, they couldn't find any exact information about how by injection could people get disease.
Can you go to the slide on not pleural but peritoneal? Okay. So any idea how this happens?
Injection.
You mentioned that pericardial people didn't know. How? For example, I don't know if you heard about bladder cancer. Can also be caused by asbestos. And do you know any information how that could happen?
I know that the main type is pleural, and in the third and fourth stages mainly of the disease, this cancer is metastasized, which it can reach the peritoneum, the all lining cells of the organs, and it could be like just because of the metastasis of the pleural mesothelioma, and also by inhalation itself by fibers that inhalate it.
Okay. Thank you.
Hello. The topic of my presentation is asbestos as a cause for lung cancer. To introduce my presentation, I would like to show some pictures. First, in this picture, the normal healthy lung is shown. The second picture here, we can see how asbestos pipes set on the lungs after inhalation, because the big main cause for the lungs diseases caused by asbestos is inhalation. So after inhalation, asbestos pipes set on the alveoli and which can lead to the carcinoma. And here we can see cancerous mass, especially this is carcinoma. Now, the outline of my presentation. First, we will see some historical facts, then what are the types of asbestos-related lung cancer, who is at risk, what factors affect the risk of developing an asbestos-related lung cancer, and what are the mechanisms of carcinogenesis. First of all, the historical review. In 1945, Leon and in another study, Lynch and Smith firstly presented that lung cancer cases can occur among workers who are exposed to asbestos. In 1955, Dole has done the first cover study among textile workers and demonstrated the excess of lung cancer among asbestos-exposed workers. Since the 1950s, many Western countries have banned asbestos, considering the number of evidences about its carcinogenicity. And the latest evidence that I found in 2007, from 2000 to 3,200 lung cancer deaths annually are due to asbestos exposure. Now the types of asbestos-related lung cancers. It could be small cell lung cancer and non-small cell lung cancer. And each of them has its own subgroups, which differs by its prevalence and among whom they are prevalent. For example, epidermal carcinoma is mostly prevalent among men exposed to asbestos, or adenocarcinoma is prevalent more among women. Now the differences between small cell lung cancer and non-small cell lung cancer. The small cell lung cancer is less prevalent. It's less than 20% among all lung cancer cases among the persons who are exposed to asbestos. It's a more aggressive form because it can penetrate through all the organs, starting from lungs and penetrate through all organs. And fewer treatment options because the surgical treatment is very rare, and so the life expectancy is too short, and only 6% of persons live 5 years or longer. Now the non-small cell lung cancer, it's more prevalent, about 80%. It's less aggressive and has more treatment options. It could have some surgical procedures and treat by that. And so it's have better prognosis. About 70% of persons live 5 years and longer. Now risk factors. who are in a big risk to have lung cancer. The workers who are involved in mining of asbestos, who are involved in manufacturing of asbestos textiles and other products, the workers who are involved in demolition and asbestos removal workers, and the last one, firefighters. Now, there are some factors which are associated with lung cancer development, which are the dose and duration of exposure, the type of asbestos, and individual risk factors such as smoking and such other pre-existing lung diseases. And now to understand the relevance of dose and duration of exposure to lung cancer development. Let's see for the study, which was done in 1974. The study was I found from the report, which was done in 2010. So more relevant and more newer studies were not done. In this study, researchers gave, the study was done on rats, first of all, 10 to 15 milligram per cubic meter doses of standard asbestos samples, five types of standard asbestos samples were given to the rats, and the results for 1 day exposure were with for chrysotile type A, 11% of rats get lung cancer. For chrysotile type B, only 2%. For chrysotile 16%, almost 89%, and unfortunately, this is for 1 day exposure. Now for 3 months of exposure, for chrysotile type A, 44% of rats get lung cancer. Chrysotile type B, 53%, and chrysotile like 42, almost like 27, and unfortunately like 16. Now to compare the doses, this were the duration. This was the duration of exposure. Now to compare the doses, let's see a study which was done by Smith et al. In 1987. Here they gave a 7 milligram per cubic meter of asbestos, and only one type of asbestos, chrysotile, which was the most carcinogenic in the previous study, and only 2 rats get carcinomas from 57. So it shows that the low dose of asbestos gave less prevalent lung cancer. The type of asbestos in 2000, Hansen and Burton have shown that the ratio between lung cancer risk for chrysotile and amphiboles, which was 1 to 10 to 1 to 15, and this shows that chrysotile was less carcinogenic than amphiboles. And in 2003, Meeker and 2007, Sullivan in Libby, Montana, has shown that from all cancers, the SMR, standardized mortality rate, was 1.4, and for only lung cancer it was higher, 1.7. And I want to remind you that in Libby, Montana, Montana, only amphiboles were mined. So it's shown that the chrysotype is less persistent, so it's less carcinogenic than the other types. And this is the reason why only this type is mined now. Now all of you remember these pictures from the first slide. Now let's suppose that this person also smokes. And we will get this picture. This is carcinoma. This is carcinoma, and all the lungs are damaged by smoking. And let's see what are more reasons for this. Co-exposure to tobacco smoke and asbestos pipes have multiplicative effect on the development of lung cancer. It was shown the association between the generation of reactive oxygen and nitrogen metabolites and cell injury and apoptosis and persistent lung inflammation, which leads to development of cancer, and also excess oxidant generation enhances the penetration of asbestos pipes into respiratory cells, and the asbestos pipes itself alter the metabolism and detoxification of tobacco smoke carcinogens. So they enhance each other and they multiplicate asbestos fibers, besides that information, asbestos fibers absorb tobacco smoke carcinogens and metals and transport them into the lungs, which also increase the carcinogenic effect. Moreover, asbestos fibers activate growth factor receptors and cell signaling pathways which stimulate cell proliferation and promote cell survival. And this is the reason why cancer is developing. We know that for the cancer development, proliferation of cells should occur, and they should survive in different and this is a summary of this information, which I already said that they amplify each other and enhance carcinogenicity. Now the mechanisms of carcinogenesis. The carcinogenesis asbestos pipes have many characteristics which affect the toxicity. For example, their crystal structure. I'll give an example. The crystal structure of chrysotype is it's like a tetrahedral silicate, 2 layers, and which are connected with magnesium atom. And it is they are connected by van der Waals bonds, which are not very strong, and it is they could be it's not difficult to fragmentize wet crystals. And for the amphibole types of asbestos, we have magnesium and which is more important, iron, which gave them more carcinogenicity and more and more expressed next one, performance size of small fries can be cleared by alveolar macrophages and absorbed by FEM. The next one is surface reactivity. They can have some iron, which is in amphophile, asbestos pipes, create hydroxyl radicals, which are much carcinogenic, and they can lead to DNA oxidation and to development of cancer. And the next one, if persistence, biodurability, and ecopersistence, which relates to the crystal structure, it's very easy to clear the chrysotile type and difficult the other types. The mechanisms of carcinogenesis can be direct and indirect. During the direct pathway of asbestos pipes, directly induce genotoxicity. They oxidize DNA, and which leads to inflammation and mutations in the DNA and to carcinogenesis. And to understand the indirect mechanism, I will show this scheme. It's much complicated, but asbestos pipes mainly it's about amphophile types. They enhance macrophages, which lead to clearance in lungs. But if pipes are much long and cannot be cleared by macrophages, they lead to release ROS, which is radical oxygen species, and radical nutrient species, and other cytokines and growth factors, which lead to DNA damage and apoptosis, and afterwards cell proliferation, and which can lead either to lung cancer and also to mesothelioma. Here are my references, and thank you.
Questions? You mentioned that smoking exacerbates the effects of asbestos. Do you know if there are any factors that reduce the effect of asbestos?
About reduction, no, because only the source that I found were only factors which are enhancing the effect of asbestos were mentioned, and no one.
Did you see anything in the literature about the relationship between asbestos exposure and having tuberculosis?
No.
You mentioned about exposure to firefighters. Like,
Yeah.
like, can you tell me how?
Because it is a big risk that construction can be demolished.
During the firefighters, if the fire
If
in the
they are
asbestos
there,
site.
if the firefighters are there, and that construction which is in fire and has asbestos in that constructs.
And besides firefighters,
Yeah,
the uniform was also from asbestos.
Yeah. But does anyone know if just wearing the uniform made of asbestos, is it a risk factor?
Well, if the uniform was worn out or torn, at that time he was exposed, but whenever it was intact and it was properly maintained, there was no risk of getting infected by asbestos.
And who decides when it gets worn?
At that time, there were no strict regulations that were.
So it's not in use anymore?
It's not.
Okay, for firefighters. Thank you.
Thank you very much for the attention. We will, as Naren and Nessa talked, we will talk about lung cancer, mesothelioma, and I will talk about asbestosis, and we will discover whether it's a really serious problem and a health condition or not. So the overview is that we will talk about the burden of the disease, about toxicity of asbestos, and the asbestosis as a disease unit. We will talk about the symptoms, how it's diagnosed, and the treatment available. So the disease burden, annually 125 million workers are affected by asbestos, and 90,000 people die each year because of asbestos-related diseases. These asbestos-related diseases are not only asbestosis, but lung cancer and mesothelioma also. There is also a non-occupational exposure to asbestos, those who live in houses or in the neighborhoods of minings where there is an asbestos exposure. And there is a rising burden of the disease because of long latency. What does this mean? This means that those who have worked in minings or who were millers and other stuff, they were exposed first time some 30 or 40 years ago. That's why now we have the higher burden of asbestos-related diseases than we had it, for example, some 40 years ago. So what are the rest of outcomes? These are lung cancer, mesothelioma, and asbestosis. And on the picture, you can see this is a microscopic view of the lung tissue, and you can find here asbestos fibers, these black ones, which are on the lung tissue, and mostly they go and sit down on the lower parts of the lungs on alveoli. And this is the CT scan this person has an asbestosis, and as you can see, these are lungs, and they shouldn't look like so. There is a thickening, which is on the lower parts of the lung, which is a scar tissue. This looks white ones, and which makes the lung it cannot breathe anymore like so. So about the toxicity, this is a estimated human carcinogen, and there is an increased rate of death due to lung cancer and mesothelioma. There is of course association between asbestos and cancer mortality, and there is no evidence for asbestos ingestion and cancer incidence, as my friends also told. It's not estimated. The literature review showed that there are some associations between ingestion of asbestosis and developing some types of cancer, but there is no single review or study which shows what some kind of specific type of cancer can be developed. And there is one more interesting thing that the observations also show that the cancer is developed on the upper parts of the gastrointestinal tract, like esophagus and upper parts of the stomach, rather than the large bowels. So the asbestos exposure is mostly occupational. That's why it was pretty hard to find any data or about the residential exposure. The occupational exposure should be very heavy. I mean, to develop the disease, there should be heavy exposure for a very long time and rather heavy doses of asbestos. And the type of asbestos is pretty important. As my friend showed, there are two main groups of asbestos: serpentine and amphibole. Amphibole types are thought to be more carcinogenic than chrysotile, which is a serpentine. This is thought because for example, in chrysotile fibers, they are made of magnesium and other chemicals, and the cells in lungs, they can convert positive magnesium ions to negative, which makes these chrysotile fibers less toxic and less carcinogenic. And as I said, it usually would take very long exposure time. The literature showed about from 20 to 40 years of exposure to develop an asbestosis. As they said, also the smoking increases the risk of developing any kind of asbestos-related disease. And I would say that there are no subclinical cases, which means that I will show the numbers then, but there are no people who were observed who had subclinical symptoms, or there were no pathologically evidence-based clinical cases. So in this case, we can say that people would either develop disease, asbestosis, or not. So what's asbestosis? It's a form of pneumoconiosis. Pneumoconiosis are a group of diseases which occur due to exposure of some kind of dust or chemicals, and they result to fibrosis of lungs. And asbestosis is classified in WHO, International Classification of Diseases, 10 as a separate unit of disease. And this is the scarring and chronic inflammation of lungs. And in the UK, there were 493 deaths registered in 2010. But this number is pretty tricky because in death certificates, even in the UK until today, they can write asbestos-related disease, and in some particular cases they can make it precise that it's an asbestosis. But many cases could be just went off from the eye because it was not diagnosed correctly. So, as I told, there is a threshold of asbestosis. In the literature review, I found 25 to 100 fibers per milliliter per year are enough to develop asbestosis, and heavy occupational exposure is pretty important, more than 20 years. And chrysotile needs higher exposure and fiber burden. It seems to be that chrysotile fibers are very easily eliminated from lungs by cells rather than amphibole fibers. That's why it needs pretty higher doses and longer exposure. On this picture, it's pretty not invisible, but the content is that the relative fiber burden associated with specific diseases that chrysotyl develops less. It needs more than other types of asbestosis. The symptoms of asbestosis is there are no specific symptoms for asbestosis, and it could be like in case of other pneumoconiosis, unless the doctor knows that there was a heavy exposure to asbestos. So these are the shortness of breath, cough, which is usually very dry cough, and for a very long time, chest pain, and here we can see clumping of fingers, which is developed due to the low levels of oxygen in blood for a very long time. And what are diagnoses? Diagnosis is an usual chest X-ray or a CT scan, but this is diagnosis is like late diagnosis, because for many years, like I said, so for 40 years, people don't develop any symptoms, and usually they don't refer to doctors. But in case if they refer to doctors, there is not also such good diagnosis done, because there are no subclinical cases, and they could be just small opaque visions on the X-ray, but this wouldn't be something very important probably to doctors, and this would be misdiagnosed. What I want to say, in the asbestos bodies are the thickness and how long they are. It's pretty important. It's estimated that 0.5 micron thick asbestos fibers have the most contribution to the development of asbestosis. But on the literature, it said that the shorter fibers are also important. But they took these 0.5 microns because in most of the cases with microscope they would detect this type. This is the level which they detect. Below this 0.5, because they need electronic microscope. That's why it could be like biased. And pulmonary function tests are needed to, like spirometry, to diagnose the asbestosis. Treatment and the prognosis, there is no available treatment for asbestosis. It's the most good one would be to eliminate the exposure of asbestos. This would stop the development of the disease. And there isn't the symptomatic therapy, like for every symptom they develop, because this could be a generalized condition. That's why there is no any specific treatment or therapy. So, thank you.
Questions? So, does it mean that this disease will be diagnosed only when people die?
Not die, but they usually have the shortness of breath or cough, persistent cough, and
No, but it's
pain.
still, you cannot confirm that it's asbestosis.
Yes, unless you have a history of heavy exposure to asbestosis.
So when could you confirm for sure that it was asbestosis?
With biopsy.
Biopsy.
Yeah.
So how?
When the lung biopsy is done and the asbestos fibers and the scar tissue is found in lungs, there are two criteria. These are the two main criteria to have a pathological diagnosis for asbestosis.
Okay, can you go to your disease burden slide? Okay, this is true for which year?
2010, I believe. This was the WHO data. I have the reference. Oh, yes, 2010.
And where the slide where you talk about estimated carcinogens? Okay. So could you please clarify the term estimated human carcinogen?
There is a sufficient data supporting that asbestosis is a human carcinogen.
What does it mean, estimated human carcinogen?
Asbestos is a human carcinogen.
Yeah.
Asbestosis is the disease.
Yeah, asbestos is a human carcinogen.
I understand, but here you say estimated human carcinogen. I would like to know what you mean.
I mean, there isn't sufficient data supporting that the asbestos is a human carcinogen.
Okay, because, you know, when you look at carcinogenicity of materials, it can be proof carcinogenicity, it can be probable
Yes, it has a grade A
carcinogenicity.
carcinogenicity.
Yeah.
So my suggestion would be to use the more specific term for carcinogens. Other questions, comments? Thank you. Could I ask one more question to the toxicity team? So for asbestosis, I understand that you need to be exposed for a long time. What about cancer and mesothelioma?
About 40 years or more,
No, that's not, I'm not asking about the latent period after which the person develops the disease.
You have to be exposed.
How much exposure would be enough to develop the disease in 40 to 50 years? I didn't see that information in any of the slides.
Sorry, the question, the latency period, you mean?
No, the latency period is very long, that is very clear. But how much exposure can lead to those specific conditions?
it also depends on the fibers.
It depends on the dose of the fibers, because there were cases I wrote it during the World War II when the workers in the shipyard, they only exposure to a few months, less than a year, they developed cancer. But it was a very, very high dose. I mean, they were living in these conditions during like 24 hours instead.
Okay. Did you see the site for the symposium, the international symposium when Ramazini colleagues came to Armenia? Because there was a whole session on asbestosis in many countries, including Armenia. And, you know, the dose-response relationship, latency period, and all of that has been discussed. So I would highly encourage you, because all the videos are available, the slides are available. You could also see some photos, like what kind of outfits the workers need to wear in different countries when they are dealing with demolition or other types of asbestos. Okay.